Hi, hello all. Today we will discuss about the anatomy of the rectum. So, rectum and anal canal both are considered to be the distal part of the gastrointestinal tract. Today we will see about the rectum. We will discuss all these things: introduction of the rectum and situation of the rectum, the curves, that is lateral curves and anterior-posterior curves, and the relations, that is peritoneal relations and visceral relations. In visceral also, the anterior and posterior relations we will discuss today, and the layers of the rectum and blood supply of the rectum, that includes arterial supply and venous drainage and lymphatic drainage and the nerves, and also the importance of the digital rectal examination. So all these things we will discuss today. Coming to the introduction part, rectum is about 12 centimeters in length, which is around 5 inches. Rectum, the Latin meaning itself is the straight, that is straight intestine. In the lower mammalian group of animals, it is in the straight only. But when it comes to humans, it was little bit curved because to accommodate in the sacral vertebral curvature. So it was a little bit curved in humans, but whereas when it comes to the lower group of mammalian animals, it was in the straight direction only. Okay. Then the distal part of the rectum is little bit dilated, that is called rectal ampulla, which main function is the storage of the feces, and when it gets filled, it needs to send the signal to the brain for the defecation. The rectal ampulla is the distal dilated part. Then the cardinal features of the large intestine, that is appendices, epiploicae, tinea and saculations. All these three things are absent in the rectum, but whereas these are present in the large intestine. Coming to the situation of the rectum, it is situated below the sigmoid colon, that is, it is the continuation of the sigmoid colon, and below it continues as the anal canal. So above sigmoid colon, below anal canal, and it is posteriorly it consists of, that is, it is situated in front of the last three pieces of the sacral vertebra, that is S3, S4, S5 and coccyx. Understand? When it comes to the curves, when we see the rectum anterior-posteriorly, it consists of two curves, that is two flexures. First one is the sacral flexure and second one is the perineal flexure. When we see the direction of the rectum, so it comes downwards, it goes backwards, posteriorly and downwards, and then comes anteriorly. So this is the direction of the rectum. So when it comes downwards and it goes backwards, it creates one flexure. This is called the sacral flexure. When it comes downwards and comes anteriorly, just above the anal canal, it creates one more flexure, that is perineal flexure. And then when we see the rectum laterally, it consists of the three curves, that is upper curve, middle curve and lower curve. Upper curve and lower curves are on the right side, middle curve is in the left side. So upper right curve, middle left curve and lower right curve. When we see the peritoneal relations of the rectum, when we divide the rectum into three parts, upper one third, middle one third and lower one third. So the middle upper one third, it consists of the rectum is covered by peritoneum anteriorly and laterally. But whereas it comes to the middle part, it covered by the peritoneum only anterior part. But whereas the lower part of the rectum, lower one third of the rectum, it does not have any covering of the peritoneum, since it is called as the extra peritoneal part of the rectum. Understand? In this cross section image we can see here. So the upper one third part is covered by the lateral and anteriorly, whereas middle one third covered only anteriorly. Lower one third consists of, it doesn't have any peritoneum. So it is called as the extra peritoneal part of the rectum. Visceral relations, that is the organs that are situated anteriorly and posteriorly. So it is different anteriorly. When we see, it is different from males to females. So in males, anteriorly, male consists of the immediately next to the rectum bladder is there, whereas females, immediately next to the rectum there is a uterus. So it is different from male to female. So upper two third of the is connected with rectovesical pouch with the coils of the intestine, whereas lower one third base of the urinary bladder, terminal parts of the ureter, seminal vesicles and prostate. That is, if we see this image, this is the cross section of the male pelvis. This is the female pelvis. So here in this is the rectum. So anteriorly here one pouch is there. That is rectovesical pouch. Vesicle means bladder. So rectum. So both are combinedly the rectovesical pouch, which consists of the coils of the intestine and sigmoid colon. And this is related to the upper 2/3, whereas lower 1/3 it consists of the base of the urinary bladder, prostate, seminal vesicles, ductus deferens. All these things are present. When it comes to the females, the anteriorly when we see upper 2/3 is covered by the rectouterine pouch. Here we will see the rectouterine pouch, which accommodates the coils of the intestine and sigmoid colon. And when we see the lower 1/3 of the cervix and lower part of the vagina and body of the uterus also we will find anteriorly. That is, so upper 2/3 consists of the rectouterine pouch and with the coils of the intestine, sigmoid colon. Whereas lower 1/3 consists of the lower part of the vagina and cervix and also the body of the uterus. When we see posteriorly, we will find that anococcygeal ligament. Here we will get the one ligament that connects to the coccyx. That is anococcygeal ligament. So anococcygeal ligament is there, levator ani is there, and coccygeus, piriformis, and along with these things, there is a sympathetic chain of the sacral vertebrae is also present posteriorly. When we do the cross section of the rectum, we will find 4 layers, that is mucosa, submucosa, and muscularis and serosa. Mucosa is the innermost part, above that submucosa, and above that muscularis layer, and outermost is the serosa. So the mucosa consists of goblet cells which secretes the mucus, so which lubricates the feces to eliminate easily from the anal canal. So here we find the goblet cells, but these goblet cells receives the mucus from the gland cells which are present in the submucosa layer. So submucosa consists of the arteries, veins, and also the glands. Whereas our third most layer is called the muscularis externa. The muscularis externa consists of the innermost circular muscles and outermost is the longitudinal muscles. The circular muscles, when they comes to the anal canal, they form as the internal anal sphincter. The outermost layer is called serosa. So these are all important in the case of carcinoma of the rectum, because the invasion of the tumor more depth, the consequences also more severe. So if the tumor is invaded up to submucosal level, it was a little bit complications, whereas it carcinoma affected up to the longitudinal muscle layer also, then it is having the severe complications. So it is important to know that in the carcinoma of the rectum. And then we will see the embryonic development of the rectum. When we see the embryonic development, it is most important in the anal canal and also in the rectum, because where it originates and it consists of the different blood vessels, different arterial supply, different venous supply, and lymphatic drainage also different for each part that is derived from the respective layer. That is, in the rectum, not only the rectum, the gastrointestinal tract starts during the 3rd week of the when zygote forms, that is when fertilization happens. After the 3rd week, the gastrointestinal tracts to develop in the uterus. So during the process of gastrulation, that is gastrula formation. So gastrula consists of the 3 layers, that is ectoderm, mesoderm, and endoderm. Through this only the all our body organs will be developed. So when we see the here, we will get the blue color layer is called as the ectoderm. This red color is the mesoderm, and this yellow layer only is the endoderm. So endoderm, mesoderm and ectoderm. So from the endoderm, the GIT will form. So endoderm, the digestive system is formed. Since it consists of the caudal end and cloacal end. When caudal end develops into the mouth and oropharyngeal organs, whereas the cloacal end starts with anus. So from caudal end, the rectum will be developed. Gut we can divide it into three parts, that is the foregut, midgut and hindgut. The foregut is from mouth to the second part of the duodenum, whereas midgut from second part of the duodenum to the 2/3 of the transverse colon, and hindgut it is from the lower 1/3 of the transverse colon to the anal canal is considered as the hindgut. So rectum is developed from the purely endoderm, whereas anal canal upper 1/3 derived from the endoderm and lower 2/3 derived from the ectoderm. So anal canal have different blood supply. So coming to the rectum arterial supply, here the main chief blood supply to the rectum is superior rectal artery. So this is the main artery that supplies the blood to the rectum. So it derived from the superior rectal artery, which is a branch of inferior mesenteric artery which arises from the aorta. So from aorta, inferior mesenteric artery, from inferior mesenteric artery to the superior rectal artery. Superior rectal artery, when it reaches the upper part of the rectum, it enters into the muscularis and serosa muscularis and then into submucosa. Till there it will develop the arterioles and gives blood supply. Major supply is from the superior rectal artery. So the middle part is also supplied by the middle rectal artery and the lower part supplied by the inferior rectal artery. The middle rectal artery is a branch of internal iliac artery, whereas inferior rectal artery is a branch of internal pudendal artery. So along with these three arteries, one more artery is there that arises from the aorta just at the place where the iliac arteries divided, that is right common iliac and left common iliac, that is the median sacral artery. So the median sacral artery which develops from the just at the junction where the common iliac arteries divides. From here posteriorly the median sacral artery comes downward and supplies to the middle part of the rectum. Is mainly in the rectum venous blood takes place by the drainage takes place due to the veins form in the plexus, that is internal plexus and external plexus. So the internal plexus are present in the submucosa layer. Here we will find the internal mucosa, whereas external venous plexus present outside the muscularis layer. So external venous plexus we see outside the muscularis layer, whereas internal venous plexus we see at the level of submucosa. So these communicate with each other and drains into the upper part, drains into the superior rectal vein, middle part drains into the middle rectal vein, whereas lower part drains into the inferior rectal vein. So that is veins correspond to the arteries. The artery, along with the artery, vein is also correspondingly drains blood from the same level, that is upper 1/3 drains by the superior rectal vein, which drains into the inferior mesenteric vein, which drains into the splenic vein and combinedly enters into the portal vein, whereas middle rectal vein it drains the blood into internal iliac vein, whereas inferior rectal vein which drains into the internal pudendal vein. The lower end of the internal plexus, so this lower end, so here we see the lower end of the internal plexus forms are continuous with the vascular cushions. So these cushions of the anal canal forms the vascular cushions at 3, 7, 11 o'clock. When we see examination, we can find the 3 o'clock and 7 o'clock, and then in the 11 o'clock we will find this. These are the venous plexus. When they are get dilated due to, or they are get inflamed due to constipation or due to different causes, they are turns into the hemorrhoids or pile masses. So when they are dilated only we can palpable them, otherwise we can't palpable them. So lymphatic drainage. So the rectum if divided into half part, upper half and lower half. upper half of the rectum drains into the pararectal lymph nodes. So along with the artery and vein, there are so many lymphatic ducts are there, which connects uh, with each other and forms the pararectal lymph nodes, which drains into the inferior mesenteric lymph nodes. So upper half drains into the inferior mesenteric lymph nodes, whereas lower half drains into the uh, internal iliac nodes. So here we will find the epirectal lymph nodes. In the upper half, we will find the pararectal lymph nodes. Here we will find the epirectal lymph nodes. The upper half drains into the inferior mesenteric node, whereas lower half drains into the internal iliac lymph nodes. Coming to the nerve supply of the rectum, since it is from the autonomic nervous system, it consists of the sympathetic supply and parasympathetic supply. The sympathetic nerves that supplies is lumbar 1 and lumbar 2, whereas parasympathetic nerves are S2, S3 and S4 nerves. Parasympathetic nerves stimulate the peristalsis and relaxes the sphincter, which results the defecation, whereas the sympathetic nerves do the vice versa, that is, it makes to constrict the sphincters. Pain sensations carried by both sympathetic and parasympathetic nerves. Coming to the rectal examination, when we study the anatomy of the rectum, it is better to know about the rectal examination, and it is important to find the any diseases related to the rectum and anal canal. So when we see the rectum examination, we also call it as the digital rectal examination, because we do the examination with the digits, that is finger digits we will find. So it is called as the digital rectal examination. So in this examination, we can't reach up to the upper end of the rectum. That is why? Because it is around, rectum is 12 centimeters in length. Again, the anal canal is around 4.5 centimeters. So total 65, around 16 or 17 centimeters. So up to that we cannot reach. So we cannot reach up to the upper end of the rectum, and we can find the we can palpate different structures in males and females. In males, we will palpate anteriorly the prostate gland, whereas in female, cervix and perineal body. In males, rarely we will find the seminal vesicles when they are get inflamed or dilated. In females, we find rarely ovaries, when ovarian carcinoma, like that conditions only we can palpate. Otherwise, we can't palpate them. In both sexes, we find the anorectal ring, that is a shelf-like projection in the anal, just above the anal canal. Then coccyx, sacrum and ischiorectal fossa we can find. When we do the examination, we have to remember three things. That is, we have to check for the mainly three things. That is, one is in the lumen, and the second one is in the wall, and third one outside the wall. When we do the examination, we have to check for the lumen. So when we do examination in the lumen, we will find mostly the fecal impaction or any foreign bodies are there. There we can find the these things. Whereas in the wall, we find the any carcinomatous condition of the rectum, or strictures of the rectum, or hemorrhoids. Hemorrhoids only palpated when they are get dilated only, until unless they can't be palpated. And also we can find the hyanal fistulas, internal opening also we can find in the wall. And outside the wall, we will find the pelvic bony tumors and benign prostate hyperplasia and distended bladder, uterine and ovarian enlargement also we can find in the outside the wall. So this is the class related to the rectum. Thank you for watching the video.